Hello, and welcome to the Daily Try, the daily podcast that supports you on your fertility journey. My name's Lara, and today I want to talk about the financial weight of fertility treatment. Whether you're going through trying to get pregnant naturally or using IVF, it's expensive. If you're doing it naturally, you've got things like, buying all the supplements. You've got all the ovulation tests. You've got taking all the pregnancy tests. It really starts to add up. And if you're going through IVF, there's even more expense. So you've got all the appointments, you've got the IVF clinics, you've got the consultations, you've got the tests, the medication. If you have harvested your eggs, you've got that appointment, you've got storage of your eggs. Costs can be really enormous, and they come on top of what's already a really emotionally exhausting experience. And plus, in the UK, the NHS funding varies wildly by postcode. So two people that live very close to each other can have very different experiences and have very different costs, which means that lots of people are self-funding multiple rounds at thousands of pounds or thousands of dollars if you're in the US each. And the US is even more expensive because the medications are so much. We're starting to see that change a bit with some health insurance policies, but it's still the cruel reality that IVF is not affordable to everyone, and there's no guarantees. I was lucky in some ways when I did my IVF because my mum had died and she'd left me some money, so I used that money, not all of it, but a lot of it. And that enabled me to go through egg harvesting and 2 donor embryo transfers. But also I went to Spain for my donor embryo transfers so that it was a lot cheaper than doing it in the UK or Australia, which is the two places I was living at the time. But not everyone has that option either. So because that requires a lot of travel and you don't always have the time to be able to do that travel. So the financial pressure can feel like another layer of failure when a cycle doesn't work. It feels really unfair. You spent all that money and you got nothing. It can create a strain on your relationship, makes things difficult in other parts of your life. You might not be able to afford certain other things. And it's just a background constant hum of anxiety that sits along everything else that you're already carrying. Because for most people, financing IVF is not something that they necessarily have the spare cash to do. It's something they have to find the cash to do. And actually, I've seen quite a lot of influencers on TikTok or Instagram who charge for their posts because that's how they finance their IVF, which is pretty, interesting, out there, good on them. I don't know if that's something I'd have been willing to do, but it's one of those things you do whatever it takes to actually get to where you want to be in your journey. But if you are feeling this financial weight, you're not alone, and it's not a reflection of your worth or your desire to be a parent. The system is just genuinely hard and unfair for so many people. So some things you could have a look into. There's charities that offer treatment grants. There's often clinical trials. You can ask clinics about payment plans. The other thing to do is when you're going to the clinic is find out exactly how much everything costs and get it all broken down before you go so that you're not, there's no surprises later. Or talk to people on the forums that have been through that and they've found alternative, cheaper options like going to Spain where the healthcare is still really good, but the costs are a lot less than they are here. I mean, getting your medications in another country can often be a lot cheaper than getting them in the UK or Australia, which is where I was getting them. So you need to find creative ways to actually get to where you want to be. But having said that, I mean, I've met people that have mortgaged their houses, have taken out credit card debt, and they're still paying it off even after the child's got to 5. So it can be really, really tough. And it's not something you save for either. It's not like, oh, I want to buy a house. I'll put money away and I'll buy a house. No one thinks they're going to have fertility problems. It's always a surprise when it happens. and you never think it's going to happen to you. So you don't put money aside to do this. You just kind of, it happens and then you deal with it. And then once you start, you kind of just keep going. One thing people tend to do is like medications, you're not supposed to give them away to other people, but often you'll find lots of forums when people do that. So that can save money. But this is a really hard one, depending on your personal situation. And I really encourage you, if this is you, to try and look for alternative ways to fund things. Like, for example, I was looking for some pregnancy tests to do some testing for my own product. And I just put a call out, does anyone have any old pregnancy tests lying around at home that they're not using? And lots of people did. And I just went and paid for postage or picked them up from their houses. And so you'll find that lots of women do have stuff that they're not going to use, like ovulation tests, like pregnancy tests, things that you can easily use again if they're not expired, which can save you money. It's a little bit of hassle, but actually it's still better than spending all that money yourself. The other thing is to look for, like I said, about grants. There is quite a lot of treatment grants out there. And then you'll often find women that are actually supporting other women going through these kind of things as well, and offering things like paying it forward and stuff. And so that's worth looking into. And really, it's all about being part of a community and finding ways to get there. And you're probably listening to this going, well, she was okay. She had the money. And it's like, yes, I was left some money, but I'm not in a massively positive financial situation in that I can afford to buy whatever I want. And that was the same situation. I still had to watch every single penny that I spent. And so I know how hard it is. And I was trying to find ways to do things more cheaply. So I went on, for example, I did acupuncture, and one of the things I did with acupuncture is I went on to Groupon and I got acupuncture deals to save money. And so I looked for ways that I could save, or often you can buy a package of stuff, like, buy 6 and it's the price of 5. And yeah, okay, you're still paying for a lot, but it's cheaper. And if you know you're going to use them, then it's worth doing. So I'd say, like, looking at those kind of things and looking for other ways that you can actually finance it. Like, if you're in the US, you've obviously got HSA and FSA. You can get pregnancy tests and ovulation tests through that program if your insurance has that. But I would hit into other people in the communities and see if they've got any of the things you need, because that could be a real way. A, it stops waste, and B, it saves you money, and it probably makes them feel good as well. So for today, I want you to be resourceful, and you will get through this, and you will find a way to make it happen. If you've got any questions or comments, put them in the on the podcast, and I will get back to you. But for now, have a wonderful day, and here's a massive, massive hug. I'll see you tomorrow.